free thyroxine index. This is an estimate about how much thyroxine is in the blood. Resin T3, this test measures the unsaturated binding sites of the thyroid proteins. So we can look to see, is there a way for them to get on the carrier system? What other tests are necessary? Other systems need to be tested to look at their functions so that we can get an overall picture of your general health and how is it affecting your thyroid problem. We run an adrenal stress index. This is a critical test, and I really like this test because it tells me a lot about, am I on target in fixing you, because I run 2 of them. Within 6 weeks of starting care, I tend to run 2 of these tests because it tells me, am I targeting where your problem is, because you should have a physiological shift and an improvement in this area within 6 weeks. You can test the adrenal glands, which your adrenals sit on top of your kidneys, and that's where cortisol and other hormones are released. Your adrenals are critical to work properly because they help you regulate your cortisol level and your sugar levels. What happens is your cortisol is released in response to stress, whether it's physical stresses, emotional stresses, or chemical stresses. It's released in response to those. And it's supposed to help you get going, and then it's supposed to calm down. But what happens is we tend to be so stressed in our society because of what we're eating and the amount of stresses that we're on, that this system gets depleted. And so what happens is you get high levels of cortisol for a while. People who have high cortisol levels tend to put on weight. Then what happens is it gets fatigued and it gets depleted. So now you don't have enough cortisol. People that have problems like this have problems getting up in the morning. They have problems getting going. They have problems with high cortisol level leads to gut problems. Well, what happens is there's a neuroendocrine system that controls the release of cortisol. It's your hypothalamic pituitary adrenal system. That's also your sympathetic nervous system pathway. And the neuroendocrine system of that gets burned up. It gets tired. So when we do our adrenal stress index, we're not just looking at treating the gland, supported with nutrition. I do supportive factors for the neuroendocrine system too. So we have to run that test to see where the problems lie. So I don't just put you on a certain nutritional supplementation for an adrenal. I look at certain areas so we can supplement it properly. If the patient is currently in stress, this test is a must. If you suffer from insomnia, diabetes, high levels of stress, sleep problems, this test is a phenomenal test. So let me talk about immune panels. Immune panels are probably the most in-depth thing that I do in my office. It's the one I really like to do because I have a good understanding of that. I've dedicated a lot of time to learning them. And I run panels on people that have been chronically suffering for 20, 30, 40 years. And they're amazed when we get these panels back how much I can properly help them. And of course they're not getting these panels done outside of in mainstream medicine just because typically they don't do them because it doesn't change the outcome of how they're going to treat you. You can be suffering from autoimmune conditions such as Hashimoto's thyroiditis. Your immune system can be attacking your body. That's why these systems are so important. It's not just having problems with TPO and TGB antibodies. We want to look and see how your immune system is doing overall. So there's 2 parts to the immune system. There's a Th1 and a Th2. And they're supposed to be balanced and they're supposed to be dynamic. So if one raises, the other one's going to come up and the other one's going to drop. They're supposed to go cyclic like that. But what happens is they get a teeter-totter imbalance. And we want to see, do you have problems in the Th1 system, the Th2 system, or there's actually another system called the Th3 system, which is the regulatory system for both those pathways. Your Th3 system tends to need specific supplementation and hormones and vitamins, and we manage those with those if that's what the problem is. So how do I determine what's wrong with your immune panels and your Th1, Th2 system or your Th3 system? What we do is when we run these panels, we run a CD4 and a CD8 ratio panel. They're T and B lymphocyte subpopulation analysis. And when I run those panels, I look to see the ratio of CD4 and CD8. One's a helper cell, one's a suppressor cell for your immune system. If you have a higher than 2.0 level, I know that you've got an active antigen that's driving your immune system, your immune system to be out of balance because it's turning it on, turning it on, and turning it on. If it's less than that, I know that your CD4 ratio, CD8 ratio, you're having trouble turning it off. And so that's a regulate Th3 system problem because you have dysregulation of your immune system. We run a few more panels looking at the Th1, Th2 system even at a smaller level. So once I know is it autoimmune related to an active antigen or dysregulation, then I come around and I dissect the Th1 and Th2 pathways. We look at cytokines, and cytokines are markers for those pathways. And if I see those markers are activated or elevated, I know which pathway is activated. So if it's a interleukin-2 or a transneurofactor that's elevated, then your Th1 pathway is elevated. If it's interleukin-6 or interleukin-10, I know it's your Th2 system. So what's the difference between the two systems? The Th1 system is for inflammation in people that have systemic inflammation throughout their body. They're higher risk for heart attacks, higher risk for strokes. They have a higher risk in general of just general health systems because that system's revved up and they're chronically inflamed. They also feel like crap all the time. So we want to work and look and manage that down. So we look at which system's revved up. Your Th2 system is your B cell. Your B cells go around and mark things to be attacked. And so they're the memory cells. So depending on which one and what's going on, what we do then is properly manage your systems. We either remove the antigen, we fix what's allowing to get in your system, we work on your regulation, or we actually do supplementation to dampen down or raise up so we can get you balanced. We look at intestinal permeability. I run an intestinal permeability test on people. This test is used to determine if you have what's called leaky gut symptoms. Leaky gut symptom describes a condition of altered or damaged gut lining. This can be caused by, first off, number one cause, high cortisol levels. That thins that barrier system. And when you get a thinning of that barrier system, it allows things to get into your bloodstream, which leads to an autoimmune response. It revs up your immune system. Antibiotic use, toxins, parasites, gut infections, all can cause you to have increased permeability of your gut wall. It's a simple test. What we do is we have you drink 2 milk sugars that come in a kit, and then one of the milk sugars is real small, and one of them is really big. They do a timed 6-hour urine catch, and they look to see in the microscope, and they count, and they get an estimation, do you have a lot of little ones, or do you have a lot of big ones? Because if you have a lot of big ones, it means it's passing through the barrier system, and that's what's causing you to have inflammatory or immune reaction. If that's what you have, we do specific metabolic supplementation to heal your gut. Remove the antigen, dampen down your immune system, and get you functioning at a much higher level. And people are amazed that in a few short weeks of doing the right things, how much better they feel and function.